Good evening, dear viewers, and welcome to today's Sunday evening show of Visite on a subject that I think will interest men very much. And I take a request from Ika as an occasion. Ika is a good friend of our dear staff member, Michaela. And thank you very much for the documents. And the question was, you were born in 1939. I also learned that 30 years ago, you had bladder cancer with post-diagnosis, then survived chemotherapy. You have to say that. These are quite aggressive therapies that take place there. You mastered it all wonderfully, but then it prompted you to turn your life around again and to abandon the addiction of cigarettes, and as part of it, make a conscious change of your diet. You also made the right choice of a wonderful partner who already has been by your side as your wife for 50 years. I believe that these are all things that will carry you through life with satisfaction. And now something has happened that has caused you to worry that is not unjustified. And thank you very much for the documents. It was noticed in February this year you had a really slight increased PSA level. And this PSA level, which is this alkaline prostate secretion, that men make also makes sense. So PSA means prostate-specific antigen. There are two parts in this prostate secretion. And that makes sense because this prostate secretion neutralizes the vaginal area of the woman, which is highly acidic, and makes it more basic so that the passage of the sperm survives and is not weakened or perhaps held back by this acidic environment. And it is so important that you also know that this is a biomarker. This is not a primary tumour marker. There are now and then high increases in PSA levels, which do not have a tumour behind it. Of course, there are also people who don't have much higher PSA levels, and still prostate cancer develops. But I will never forget that I was a young student, and back then in the lectures, we were told that the older people are, the more likely they are to get prostate cancer. And now this name carcinoma is always connected with a fear and a worry. We don't actually use it in our clinic, but for us, these are mitochondropathies, which they are looking at the metabolic processes. So every tumour cell, or every cell that was healthy and can develop into a tumour cell, has an altered energy metabolism. And I don't want to say so much about the subject of tumours, just a slightly elevated PSA level as found in you was 14.8, and there is a grey area of about 4 to 10 nanograms per milliliter. Man, and when it's 14.8, then it starts increased PSA, and I know what kind of avalanche that sets off. It is exactly the same as if a woman now has a small lump, maybe a small mastopathy or a small hormonal disorder, but one suspects it could be something else. In that moment, the world is not the same. And you've been through a little bit now, this time, until perhaps calm has returned. and the diagnosis has been confirmed. So I have a CT scan in front of me. It wasn't made until May. So in between were February, March, April. Almost 3 months, which I don't understand very well. If, for example, you really suspect carcinoma, why is so much time in between? But then an MRI was done without contrast agent. And of course, I think that's very good because you do not have the high gadolinium exposure from which we see more and more which dramatic side effects this contrast agent also has. And whenever you could do it without it, that's a very good decision. In any case, the diagnosis is hyperplasia. And hyperplasia means the prostate has enlarged. A man who's been happily married for 50 years and joy of life knows no age, and also physical closeness, and also to be allowed to maintain sexual contact even in old age, can increase PSA levels a little. It's a very physiological adjustment. Also some activity, and you are still incredibly active in your life. You ride a bike. I recently had a cyclist who not only had a level of 14, but it shot up to over 20 after a bike tour over the Swiss mountains. You can expect that. And when you're at it, of course, and determine a PSA level, then that sets a certain concern in motion at first, but everything is fine. It's hyperplasia. It is an enlargement of the prostate, as it is allowed to be at this age. You just have to make sure that the prostate has space outwards, but if it also grows inwards, then it affects the urethra, and of course that sometimes becomes critical because that puts strain on the urethra and with it the bladder, and the discharge from the bladder, and sometimes urinary retention is a consequence. It is important to understand what might be behind prostatic hyperplasia. But Michaela was kind enough to send me your laboratory values, and it struck me that the gamma GT value was a bit too high. The gamma GT value is the alcohol-dependent transaminase of the liver, which is actually responsible for breaking down alcohol, among other things. At that moment, I also looked at the zonulin, which is measured in the blood, a very sensitive factor. However, it shows whether the intestinal barrier is actually still closed, whether what is allowed into the body via the intestines has really been checked enough, and as with Cinderella, only the best is allowed in. This zonulin was very borderline. This means if you have a habit of eating fruit in the evening, please don't. If you still eat a lot of raw food in the afternoon, please don't do that. The digestive, enzymatics and strength is in the morning and until noon. This means that many fusel alcohols can be produced, of course, through fermentation processes in the intestine. Of course, the metabolism of fat and protein also creates scatol, hydrogen sulfide, but all these things can now get into the body unhindered with this mucous membrane barrier is open, and then of course they are immediately present for the next one and demand more enzymatic power than maybe the liver can afford, and then a gamma GT rises. This gamma GT value is of course only increased adaptively, and you can regulate this wonderfully by following this matter here. And now try to recognise, is there possibly silent inflammation? So I would also arrange a stool sample here to measure an alpha antitrypsin, a calprotectin. Are there any food intolerances now? Is there also perhaps a parasitic load in the intestine? Maybe you also have a small dog at home, or do you take care of Michaela's dog sometimes? It's all so important. You know, there are so many microorganisms in us too. Parasites, fungi, worms, pinworms, roundworms. We don't even notice anything. But they produce up to 10,000 eggs a day, and that can also burden the intestine more than we think and cause such disruptions. You really should be doing this. I also noticed that the lymphocytes were a little too low. So the normal value of the lymphocytes is 20 to 40% proportionally, and it was 13.4%. Now, of course, the production of lymphocytes can also have come into contact on the intestinal mucosa to sometimes exhaust itself. That's no question at all. But they have duties in defence, and they must also be available to life and the body in a healthy defence. It is therefore very important to ensure that you know more about the intestines so that you are also not flooded with this microbial, bacterial, viral, parasitic load. And don't reduce the immune system with a certain, I would say, overload. I'm always very happy to give the microimmune drug 2L-EID to patients. You can use it to modulate the immune system and stabilise the lymphocytes again. Provided, of course, you know the background and try to clarify it at the level of the intestine. Try to relieve the intestines with good enemas and maybe sometimes also good antiparasitic therapy with black walnut, with artemisia, with Mimosa pudica. Please remove gluten from your diet. Today we see in 85% of patients that they really react with inflammation. Then I believe you can do a lot of good for the intestines, but also for the liver and thus for the overall immune performance. That's not all if you have prostate hypertrophy, because you always have to be aware that, of course, a lot of things can also stimulate the growth of the prostate, and above all, those are hormones. And, of course, the man is just as required to realise a healthy and sufficient hormone production himself. That means not only does he need good testosterone, but the man also needs progesterone, pregnenolone, and estrogen. Not in the same relation as us women, but estrogen dominance, for example, can activate an enlargement of the prostate. The prostate can also enlarge if estrogen is just too dominant over progesterone. That means you have to look at it now. Are these two in good balance, or does an estrogen dominance occur due to insufficient progesterone? Can you imagine that? So you don't have too much estrogen, you just have too much because you have too little of the counter hormone. This is a very important consequence that you can now take from a saliva sample. I like to measure the hormones in the saliva. Then it's the active hormones that you can get an overview. The other thing is that, of course, so many plastic products contain phthalates. Bisphenol A is a plasticizer, and they also say that these are xenohormones. They don't act like a poison in the body, like a toxin, but they can act like a hormone, and they can actually stimulate this process adequately. So they have an influence like an estrogen. This means if now your wife uses an incredible amount of plastic in the kitchen and Tupperware, maybe from the past, try to swap everything slowly. Even in a coffee machine that has plastic, these phthalates are released. When you go shopping, please do not necessarily buy the water in plastic bottles, but always make sure that you have glass bottles and that you use these glass bottles again and again with good water. These are such small things, but they are very important to really calm this process, that you can stay healthy in strength and dynamism, even with a certain enlargement of the prostate. The other thing is that, of course, through many other loads that we experience, and a life born in 1939 has a few years under its belt, and is, of course, in the situation that it has to reinvent itself every day. And every day there is the same pressure to detoxify things. And lovely Michaela, when she is with us in the clinic and does the DART field, gives the patients such valuable advice. Please support the kidney, support the liver. This is so wonderful that naturopaths focus on the elementary regulatory processes. How poor would medicine be today if we didn't have this clientele of helping therapists at our side as doctors, which support the body in this direction? Because an expression of dysregulation of an illness is always the situation that the body is overwhelmed in the context of its compensation. And that is very important here, that you know my detoxification can be overwhelmed due to high loads. And you can measure that very easily. Do you have a toxic load? Are you burdened with things you don't know? How is your own detoxification? That could be a very important point at the moment. Why? Because this estrogen, maybe you measure it increased. Maybe you don't measure it increased, but I just thought I'd say again as a thought, it has to be broken down by an enzyme, and that is catechol transferase. And this catechol 0-methyltransferase is an enzyme that breaks down dopamine and also estrogen. You can sometimes see that the strength of this enzyme has weakened, that some of it has a genetic defect. This means if that were so, then one would have to be aware of how this enzyme's capacity be activated again. And there is the Ganziman laboratory in Mainz, but also organic. It does these genetic tests for the activity of catechol 0-methyltransferase. I would really recommend that to you at the moment. And of course, everything else is also important. The whole prostate is regulated by the bladder-kidney meridian. What's going on in the tooth and jaw area? We say today almost 70% of malfunctions in our body are caused by a so-called interference field. The body cannot regulate a process with the same force, with the same energy if it lacks energy. That is 5,000 years of Chinese medicine. So how is the tooth and jaw area? Are there any interference fields, especially of the front teeth? The two in front here, the two below, these are really very important energy channels also for the supply of the prostate and the urinary bladder and the kidneys. You can also go a little further and say, I saw that the lymphocytes are low. Maybe you'll do a lymphocyte transformation test. Or rather, a lymphocyte typing test. Please, not a transformation test, a typing test, so that you can look at all immune fractions again. Just to see again exactly how balanced your immune barrier is. Is there perhaps a tendency towards bacterial load? Is there a tendency towards viral exposure? these are also things that can affect prostate hypertrophy. And I left out the whole toxicity issue. I've already spoken about it a bit, but also the prostate is an organ that takes in toxins. That's why I always advise women you can protect your men well if you also allow them sex, because it drains the prostate secretion, and with it, of course, the prostate has a little relief of pressure in the context of a toxic exposure. These toxins can easily be discharged through the prostate secretion. That is a very important decision. But over a short period of time, the question arose, maybe it is a prostate carcinoma after all, and I'll take you back to the beginning. As a young student, I was very shocked when my colleague told us that almost all men over 90 were prone to prostate cancer, and the elderly man goes from this world with prostate cancer and doesn't die of it. And that moved me a lot at the time, and thank God you're often older, and thank God you don't do much anymore then. And we actually still use a procedure in prostate diagnosis today, the so-called punch biopsy, which means that you go via the rectum and have, I think, 20 centimetres by a 5 millimetre large punch cannula, and then pull out the appropriate material via the punch cylinder. And with this quite rough diagnosis, in my opinion, of 5 preparations, you're already at 20 today and can often fall back on a 50 times punch biopsy, where I just asked myself, with a really good structural ultrasound, I can detect prostate cancer today and work in a much more targeted manner and with few punch biopsies, but that's how you do it. And then there's the so-called Gleason score, with which the degree of malignancy in prostate cancer is decided, so that a diagnosis is actually always granted. It's prostate cancer. You can then use this score to make a certain differentiation in the frequency of metastasis. But actually it always leads to very analogous behaviour. Either prostatectomy, prostate removal, or hormone therapy or radiation. And in this situation, I just want to point out again that there is also a so-called fine needle cytometry. This is a much gentler examination that not only examines the tissue of the prostate but also cellularly, intracellularly, examines the DNA of a prostate cell. And in the context of this histological fine needle cytometry does not lead that often to overgrading. This means small grades of malignancy, and it is said in 48%, almost 50% of all prostate cancers. Watch and wait. Wait, wait, wait. They are growing so slowly, really, it has no meaning at all for a 75-year-old, because what will be in 10, 15 years does not need to be overrated now, and these very small, low degrees of malignancy cannot be detected at all with a punch biopsy. The other thing is that even these different gradations which you know in a histological finding, type A, for example, in the case of peridiploid, but also in the case of the tetraploid, then that would be type B. That is 25% of prostate cancers, that they have a stronger DNA disorder. But now you have to look at how you can advise a person what is best to do there. But what you simply know is that, for example, this type of tumour has fewer hormone receptors. And you very easily tend to block here with hormone therapy. But these hormone receptors are hormone deaf anyway. After 32 months, which means that you have to take care of the causes and you have to act therapeutically differently than with hormone therapy. There is, for example, intensity modulated radiotherapy, IMRT, that is not done everywhere, but it is very focused through unbelievable focus with 360-degree application and regulates 95% of the radiation energy right here on these cells. So this is an incredible, great technology that is created there. And then, of course, there's also type B or B and C, which then, of course, really have a higher degree of malignancy. But that's only 25%. I just want to tell that again at this point to men in general, and my colleague Dr. Herbert Bliemeister made a very nice ebook, Prostate Cancer, because they do not know what they are doing, actually from his years of experience as holistic big thinking urologist. So a person who is now faced with the situation can decide and can also read well about things that can also follow the experience of a quick prostatectomy with everything that is often connected for the individual. I don't want to go into that at this point, but I think that's all very valuable information that will help you to make the right decision in such a situation. But here, in your case, Eek, the all clear is announced anyway. With this in mind, I want to wish you all the best for now. Above all, both of you together, and thank you very much for letting me answer these questions, and best regards to Michaela and Karl Heinz. Have a wonderful Sunday evening, all of you. Thank you for your sympathy and listening to me again. I'm really looking forward to next Sunday evening. Goodbye.